Starting at around Christmas, we began to see a sharp increase in the number of cases of COVID-19 that we were experiencing in the Bay. This spike coincided with the spread of the Omicron variant. To some extent, we saw what was happening in larger cities such as London a few weeks earlier. The pattern is that our cases continue to rise and are beginning now to stabilize or fall. However, we are still seeing an increase in cases in the school-age population. The highest age group that was affected was the working-age population, typically people under 40, but we have seen increases in all age groups. Indeed, we have seen the impact in our care homes where a large number of residents and staff have tested positive. The consequence for us in the Bay have been mostly around disruption to work. We have a large health and social care sector in proportion to other places. We also have a large number of people, or high proportion of people, who work in hospitality. And these have been sectors that have been particularly affected by the high case rates in the working age population. We have high levels of vaccine uptake in the Bay, and we continue to make every effort to encourage our residents to take up their primary doses, their first and second doses, and to have the booster when they become eligible. And thus far, we've had good success. We certainly have uptake rates that are on par or better than the national average. That, I think, has helped us to keep the consequences of severe illness relatively low in the Bay. And so despite having record levels of new infections, the highest that we've had since the pandemic began, we have not seen an increase in hospitalizations to the level that we saw in earlier waves of the pandemic. This is not to say, however, that we should be complacent. The NHS has been under strain. Social care has been under strain because of the increase in cases and because of the impact on staff. And many in hospitality certainly did not have the expected profits that they were looking for during the festive season because of staff shortages as a result of illness, but also because of people modifying their behavior and the uncertainty around the spread of the variant. And many people were taking sensible actions to reduce social contact and unnecessary social interactions as much as possible. A lot has changed in terms of the guidance, and it's useful to update on a couple of key changes that have happened over the period. The first is it is no longer necessary for you to have a confirmatory PCR in order to need to self-isolate. And that is because when the background rates are this high, a positive lateral flow test is likely to be accurate and indeed indicate that you have the illness. If you are without symptoms and you test negative on day 5 and on day 6, you can reduce that isolation period and go out on day 6. So 5 days of self-isolation with negative lateral flow tests at day 5 and day 6. If you test positive, then you need to continue to self-isolate for that period until you have 2 negative tests 24 hours apart. It's important that all of the necessary precautions that we take to protect ourselves and those around us continue to be in place because our background rates are so high. However, as the rates fall, we will see a lifting of restrictions, and we will be able to gradually do more in terms of going out and socializing. But it is important that we do so in a measured way, and that we continue to be sensible in our approach, so that we can get to a stage where we are responding and living with COVID and any new variants that may come, that may arise over time. It is my wish that as we go through this new year, that we will indeed see the turning point where COVID will not dominate our day-to-day activities in the way that it has over the last 2 years, but that we will learn how to live with it and continue learning the lessons of the last 2 years, so that we can continue to be safe in the face of what we hope will be a reducing threat over time. Best wishes for the new year.